Chronic kidney disease is a description of having not normal kidney function or having abnormal structure to your kidneys, and it can be detected by a blood test, by an ultrasound of your kidneys, or by finding something abnormal in your urine when it's dipped, either blood and or protein. It's a descriptive term and it doesn't give you the diagnosis of why your kidney function may be abnormal. So chronic kidney disease is more common in people who have high blood pressure, in people who have diabetes, but many people who have chronic kidney disease have no idea they have it. You may have no symptoms at all until your kidney function is only about 10% of normal. Some people, if they are leaking a lot of protein in their urine, can notice that their ankles are swelling, even their legs are swelling, and sometimes they wake up with a puffy face. Sometimes, if your kidney function is not very good, that can cause anemia and you might feel tired and under the weather. But actually, most patients with chronic kidney disease do not know they have a problem with their kidneys, and they need to have a blood test and they need to have their urine dipped and their blood pressure checked. There are some more general diseases that can cause kidney disease, and you might have symptoms from them, such as a condition called vasculitis, where you may get a rash and pains in your joints and fevers. And there's also quite a common condition affecting young women called lupus, which can also affect your kidneys. And again, different type of rash, also swelling, fatigue, you might notice some hair loss. So there are lots of symptoms you can get that may be nothing to do with your kidneys, but actual chronic kidney disease needs tests to make the diagnosis. There are two aspects to treating chronic kidney disease. The first, in my view, one of the most important, is actually to make the diagnosis, because it's often assumed to be due to certain things and it's not always the case. Sometimes you need specific blood tests, and sometimes you might even need a sample of your kidney tissue taken, a kidney biopsy, to look under a microscope and make a specific diagnosis that would need treatment for that condition, such as lupus or vasculitis. Other times we know if you've had diabetes for many years that it might be the likely cause. The other aspect to treatment is not just treating the specific underlying disease, controlling your blood pressure very well and treating your diabetes, but also to look after your kidneys in the long term. The key ways you look after your kidneys in the long term and to prevent the chronic kidney disease getting worse, a tight control of blood pressure. And we tend to use specific blood pressure tablets that not only reduce the blood pressure, but reduce any protein leak you might have from your kidneys. And we know they're kidney protective. But above all, we want your blood pressure very well controlled. The next most important thing is to avoid tablets that might upset your kidneys. And the biggest group we always warn you about are not to take anti-inflammatories like ibuprofen, Nurofen, Voltarol. All those sort of drugs can be really damaging to kidneys if you already have chronic kidney disease. You should stick to paracetamol or other types of codeine-based treatments for treating pain rather than anti-inflammatories. Something you can do quite easily is think about the amount of salt in your diet. Reducing salt definitely reduces blood pressure, and the recommended total daily intake of salt now is only 6 grams a day. And there's an enormous amount of hidden salt, especially in processed foods. So reducing that would help treat your blood pressure. And the other important general factor is to stop smoking. Of course, that's terribly important for your lungs and heart, but kidneys don't like smoking either, and people who smoke tend to have their kidney disease progress more rapidly. If you have chronic kidney disease, you can almost certainly have a baby, but the art is to think about planning and to discuss it with your doctor. The first thing to say is that until you're going to try and get pregnant, you need to use a safe form of contraception. And for most women, that would be a progesterone-only pill or a progesterone-only based form of contraception, not an estrogen-containing pill. But when you want to think about having a baby, it's very important to discuss it with your doctor who's looking after you. There are things to take into consideration. In general, it's better to have your baby when your kidney function is better, not worse. So if you have a condition that we know is going to progress and your kidney function is going to get worse, then you should do it sooner rather than later. But you do need to think about the medications you're on and whether they're safe for a baby, and sometimes certain medications need to be stopped before you get pregnant and changed to baby-safe ones. All of this needs discussion about the best timing. If you have a disease like lupus, your disease needs to be quiet for about 6 months before you try and get pregnant. And you should be discussing this with an expert who understands both kidney disease and pregnancy. But it's definitely possible, and in general, the better your function and the better controlled your blood pressure, the safer the pregnancy is going to be.